Healthcare disparities are prevalent across Latin American countries and lead to inadequate and unequal access to medical care. A healthcare disparity is a difference in health outcomes, and this problem is critical to expand on because quality healthcare must be attainable no matter where a person comes from, and this is certainly a step forward in refining the system and the policies within that region. In order to understand the disparities in healthcare, one must learn about the different styles they exercise for medicine. What type of medical practices do indigenous people use, and do they follow traditional medicine or mainly modern techniques? Main factors of indigenous medicine revolve around a more holistic approach because they believe that the mind and the body are intertwined as one. Traditional medicine consists of herbs, cleansing ceremonies to heal one's spirit, and the way that they focus on patients' physical and emotional health together. Traditional healers are prevalent because of their accessibility and affordability. And on this note, the choice to utilize modern or traditional medicine can affect health outcomes, specifically in childbirths and maternal mortality. Around 8,400 women die each year in Latin America due to pregnancy, childbirth, and postpartum complications. But 9 out of 10 of these deaths are preventable through quality care, meaning that access to comprehensive care can heavily reduce maternal mortality. With modern medicine, they utilize screenings, immunizations, and counseling for optimal prolonged care. With traditional medicine, they strongly emphasize a holistic approach, and the close-knit bonds within the indigenous people are crucial for encouraging a mother through her pregnancy. The emphasis on cultural traditions and supportive network of care are never neglected, and there is an estimation of more than 400 million Latin American people who follow this form of healthcare. On the other hand, limited use of technology with traditional medicine may not handle complications as well as modern. Postpartum infections like sepsis cannot be treated as efficiently with herbal remedies compared to modern medicine's access to vaccines or antibiotics. If a baby has an irregular heartbeat, it'll be harder to be detected without electronic devices. Now, the way indigenous people approach and perform medicine, specifically in childbirth, can reflect the healthcare differences in urban versus rural areas. So, Latin America is recorded to be one of the most urbanized regions of the world, but the rural areas often depend on midwives more for home births due to preferred cultural practice or how it's lower cost and accessibility. Unfortunately, there are risks with the use of traditional midwives because they often have poor access to support services and work in conditions of poverty, and there are minimal Latin American countries with professional programs that offer proper midwife training, and Dr. Virginia Camacho also explained how midwives are not competent to treat unexpected problems like hemorrhaging. Drawing back to how Latin America is an urbanized region, it is important to note that they also have the second highest birth rate in adolescents. And this is relevant because when the topic of healthcare is addressed, it does not just mean physical health, but also reproductive health and the quality of education surrounding safe-sex practices offered to these teens. Adolescent births are correlated with poor birth outcomes and can lower their chances of future educational opportunities. And over 95% of adolescent births occur in the middle to lower socioeconomic class. This is prevalent in both urban and rural areas because urban social factors like crime and violence significantly impact their health and well-being. Given that many adolescent births occur within the lower social classes, one must wonder, what other barriers do these women face when it comes to access to quality healthcare? A survey was conducted, and it consisted of Latin Americans, and it was found that over 62% of them denied medical care due to not being able to afford it or they simply cannot access it. Over 24% of healthcare costs are out-of-pocket expenses, which gives Latin Americans a heavy financial burden, and if these individuals can barely afford healthcare, it puts them at a higher risk of complications that could have been prevented through routine checkups. And instead, the people in the lower class now have to face health risks and financial instability on top of that. Now for the fortunate areas in Latin America who do have accessible clinics and hospitals nearby who can receive proper healthcare services, we must address and consider whether these facilities can meet the people's needs. Do they have enough qualified doctors and staff? Are they equipped with the necessary tools to handle diverse problems that might show up? According to the World Economic Forum, many Latin American countries don't meet international standards regarding the ratio of doctors and nurses per patient and the ratio of hospital beds per patient. If a community does not meet these standards, it's often because they're located in capital cities, and the other areas are neglected to an uneven distribution of healthcare workers. To gain a more personal and raw perspective into Latin American healthcare, I talked to my best friend's mom, who was born and raised in Cialis, Puerto Rico. And we discussed if she felt that healthcare services there were always available and if they were of high quality. And I also asked about her community and how their support impacted her experience. To sum up our interview, she basically said how there's local clinics for routine checkups or medications, but regarding serious health conditions that she fortunately did not have to face, they'd have to travel to larger capitals or they'd have to wait for the doctors to come to Cialis. But fortunately, the community was always uplifting and always supporting each other through hard times. While community support, like my friend's mom had in Cialis, played a vital role in overcoming healthcare challenges, it's still clear that systemic issues plays a big part. Are there certain policies placed to address these prevalent healthcare concerns? What impacts do globally wide organizations have on Latin American healthcare and what are they doing to help improve it? The Pan American Healthcare Organization and Global Affairs Canada came together to create a project titled Integrated Health Systems in Latin America and the Caribbean. Their plan focused on women's, children's, and adolescent health, supporting reducing disparities and creating better access to these areas by utilizing result-based management. All in all, it has been made clear that healthcare disparities occur all around Latin America, and easy access to healthcare and the quality of care are essential. Traditional medicine and support from one another are significant, but major systemic problems like uneven distribution of medical resources, financial barriers, and a shortage of healthcare workers need to be talked about. Quality healthcare must be attainable no matter where a person lives or where they come from, so learning about these disparities can influence the government policies to create the proper funds in refining their system. Healthcare accessibility is inconsistent, and this research will help find areas that require the most attention because healthcare is a fundamental right.